Good afternoon, everybody. I'm Dr. Kelly Burkenstock. I speak on a lot of venues. Yesterday we spoke on weight loss and the 8 parameters that help you lose weight. We're all about beauty, and beauty just isn't in the makeup or on the outside. Beauty's in the inside too. So we're very into preventive medical management, anti-aging, holistic health care, as well as beauty too, because we all want to look good as well. So today we're going to do a 20-minute transformation on one of our clients, and we'll get to that at the end of the talk. But first we'll give you a little preliminary information on what exactly can we do these days to look a little better without doing something extensive like a surgery, because none of us really want that, right? I've studied locally and abroad with Dr. Kanasopoulos in Greece, Dr. Kardashian in Greece, Dr. Hema Sundaran up in Virginia, Dr. Gravier in Atlanta, Georgia, Dr. Runels in Fairhope, Alabama, and Dr. Patricia Rites from Brazil, as well as Dr. Jacques Lacaze from Belgium. So I bring to the table just some different international and national methods of skin rejuvenation without surgery. Leonardo da Vinci, way back, when he was drawing the face, he realized that there were mathematical parameters around the face, and that these mathematical parameters were exact in certain defined areas of the face, between the nose and the eye, between the eye and the base of the nose, the nasolabial folds, between the nose and the lips, the parameters of the lips from the side, and so on and so forth. And that became something, when we later found out, was the parameters of beauty. So whether it's Angelina Jolie or some of Elizabeth Taylor or some of your international models, those same parameters of the face, called the mask, the beauty mask, can be translated if you take that mathematical equation, which is designed by that engineering mask, and you put it face to face to face on the international models. What you'll find is that every female that we think of as beautiful, although they may not look the same, they have the same mathematical equation. Does that make sense? So the proportion of the eyes from the bridge of the nose, the lips from the base of the nose, so on and so forth, when they are in a certain mathematical parameter, it portrays beauty. If you're not built exactly that way, we can tweak it with a little bit of Botox and fillers. Here's Elizabeth Taylor. Beautiful, very young, and still beautiful as an older adult. Why is that? One of the biggest things is ageless beauty is due to volume. And when we lose volume, it's like a tire in a car. When we lose volume, air out the tire, things shrink, things fall, they become less three-dimensional, and we look old. By simply taking the volume with fillers and putting it back in the face, we look young again. In addition to fillers, which are temporary, they can bind with your collagen to actually make new collagen beds, and so you actually, it's the gift that keeps on giving. We can do things such as platelet-rich plasma, PRP, radio frequency needling laser, some other different venues that will rebuild collagen and elastin on a long-term basis. So when we're talking about beauty, as we age, and the photo effects of the sun, the environment, the different toxins that we eat and drink, when we want to put some collagen, elastin, fibrin back into the skin, what we want to do is relax the wrinkles, fill the lines, restore the volume, and rebuild collagen and elastin. When we do this, we can turn back the hands of time. Botox is a wrinkle relaxer. So with those heavy movements of the face, those muscles become hyperactive and lines form. When we calm down those hyperactive muscles, the lines fade. If we continually relax the muscles with Botox over time, you actually will cause an atrophy or a weakness in the muscle. That would look horrible in a leg. For example, when we wear a cast, if we had a broken leg, and then when we take the cast off, the opposing leg looks wonderful. Why? Because it was used all the time and the muscle builds up real nice. The leg that had the cast on it becomes weak, droopy, and atrophied and looks awful. What looks awful in an extremity actually looks wonderful in a face. So when we relax the face with Botox several times over the course of a couple of years, we're causing a little bit of atrophy in that muscle, but that muscle was so hyperreactive or hyperactive in the first place, it's what caused those nasty lines that we can descend or take back in time. There's an example of Botox before and after. You can see how wrinkled the forehead and the glabella between the eyebrow area was, and then how smooth she is on the opposing slide. Dermal fillers are used to restore volume. We can enhance the lips, and no, we in our clinics do not build duck lips. We don't want anybody quacking. But if you gently restore the lips, because lips do lose a tremendous amount of tissue over time, gently restoring the lips is very, very pretty. When you rebuild the Cupid's bow, which is the nice prominent philtrums between the base of the nose and the top of the lip, that is a sign of youth and beauty, which we lose quickly as we age and can be put back in a second. Here's an example of what we were able to do with fillers. If you'll look in the before slide in that lower mouth, lots of wrinkling, and she almost had a folding over of that lower skin, where we call the marionette area, where you can become sort of puppet-like looking, and in the nasolabial folds or the deeper smile lines. We also enhance the lips just a little, and she looks like a younger sister or another version of herself. This is what I was describing earlier. Some of you may or may not have heard about this, platelet-rich plasma. That's when we take a small, tiny amount of blood, we spin it down in a very special centrifuge machine built specifically to protect the platelets, and what comes from that is platelets filled with stem cells, growth factors, EGF, IGF. What we know about those growth factors from the plasma is it rebuilds. For example, Drew Brees from the Saints this year, he had a bad shoulder injury. The last thing they want to do is operate on a football player, because then that $1 million project, a multi-million-dollar project, is out for the season. So what they did do was inject him with platelet-rich plasma, PRP, into that arm. The platelet-rich plasma are sort of like immature baby cells, and they go in there and say, ah, we've got an injury in the shoulder. So what you want me to be is new shoulder tissue, fibrils, tendons, ligaments. You want me to rebuild that, right? And it goes in there and does that action all on its own. So when you take these immature baby cells and you re-inject it into the face, it says, oh, I get it. You want me to be new skin cells, collagen, elastin, young tissue. I can rebuild that. And so over time, it's sort of like putting seeds, fertilizer, sun, and water into your garden. And over time, you rebuild a beautiful landscape. The platelet-rich plasma can be used in any area of the face, jawline, cheek tissue, under the eyes, around the mouth. It's also used dynamically in all areas of the body: neck, cleavage, décolleté, and then in middle-aged people who are going through menopause for women or andropause for men. It can be used to treat the genital area, which if someone were having urine leakage or urinary incontinence, lack of libido, or for the male if they were having issues with performance, it can absolutely help in those departments as well. So this is a little bit what we were saying, contain menopause with the libido issue. Yes?
PRP, are you using your own blood supply for that?
Great question. So the question is, for the PRP, are you using your own blood or are you using some outside source? It's absolutely your own blood. So that's the beautiful thing, is because it's totally natural. So we're taking a little bit of your blood, spinning it down and re-injecting it into you. It depends. It would be very much like the landscape at your house. Okay? If you wanted to just plant new pansies, that's fine. But if you wanted to build a whole new garden, every time you go out to that garden and weed and fertilize and put new seeds down, you're going to improve the garden more and more and more. Yeah. And for males, it's very, very helpful in the erectile department. Complexion resurfacing. So we've talked a little about rebuilding instantly, calming down instantly with Botox and fillers. For the complexion department, if you've got some aging, some deeper wrinkling, some saggy elasticity, or if you've got some modeling. So what I mean by that is brown spots or red spots or maybe some little scars from acne. Those, we resurface that by using CO2 lasers, radio frequency needling, micro needling, BBL, broadband light. And those will actually rebuild the complexion tissue. Some of those have downtime, like for example the CO2 laser you'll be peeling for about a week. And others, like the BBL, for example, broadband light, have no downtime at all. So you could come in and go back out after lunch, go right back to work. In the day and age that we live in, it is very, very common for ladies to have breast implants, whether it's for cosmetic reasons or whether it's after a breast cancer where they've had a mastectomy and then have new implants put in. Regardless of why breast implants are chosen, there are 60% of the women that have breast implants have an issue with them down the line, and it becomes a very shaming disorder, which it shouldn't be. Very often, 60% of the time, one or both will get hard. If it gets hard or lifts out of place, before the only thing they thought could help was surgery, well, what happens after the surgery? 90% have a recurrence, because the issue is a capsulation problem. And we have a non-surgical option for that called the Aspen Deep Ultrasonic Physical Manipulation Medication. It's a whole treatment plan. I bring this breast implant therapy up because I'm hoping to spread the word that there is an answer out there for someone who's suffering with this, who may not be talking about it or may have shared it with a loved one. Please let them know we have a cure for them. Leg vein therapy, we also do. It's leg season. Takes about 3 treatments usually. So March, April, May, you're ready for the beach by June. That's a sclerotherapy, so we inject and then we laser on top. It takes about 45 minutes. You can go right back to work, go right back shopping. Tattoo removal, that's of course with lasers. Tattoos are so easy to get on and so hard to take off. But with about 10 to 12 treatments, once a month over the course of a year. This is a lady we did, you can see on the left, she had a big angel across shoulder to shoulder, and this is after we finished on the right. Laser hair removal, it's beach time. Takes about 5 to 7 treatments to get the hairs down. Okay, so without further ado, we're gonna bring Miss Amy up here, and we're going to do a 20-minute transformation. So first I'm going to be injecting Botox. There are actually 3 different versions of Botox now. So there is Dysport, Xeomin, and the brand name Botox, very much like Kleenex. So there's many different brands of facial tissue, puffs, generic facial tissue, Kleenex. But when we go to grab a tissue, quite often we say, pass me the Kleenex, regardless of what box we're taking it out of. Same thing primarily with Botox. Okay, so I don't know how much y'all can appreciate from there, but can you see how Miss Amy here has some wrinkling of the forehead? Go ahead and make a mad face. And when she pulls in, she's making a lot of wrinkling called bunny lines across the nose. Smile. A little bit of crow's feet here. Put your bottom over your top lip. As we get older, the chin gets hard and it pinches in almost like a golf ball. And what happens with that is you pull down. Everybody wasn't built with a Jay Leno jaw, were they? As we get older, we all become more like Jay Leno's jaw. And the way to prevent that is to put a little Botox in here. So it softens this. When you stop the pulling, you stop the aging effect of those strong chin muscles pulling down. Go ahead and raise your eyes. So I'm just injecting a little Botox across the main muscle grouping of the forehead. Forehead muscles are actually vertical, but they make a horizontal line. The type of needles that we use are extremely tiny, smaller than if you're familiar with a diabetic needle. Oops. So that it's a tiny pick, but it's really not painful. Go ahead and make a mad face. Now, Botox will take 3 to 7 days to take its full effect. You'll notice some immediate slight calming, but its full effect will take at a week. Smile. Smile. Put your bottom over your top lip. Okay, Botox is finished. Good. Now I'm going to place some filler. So what I'm doing now is I'm measuring the angles of her face, because if I just put it in like a cookie cutter, like the little manual that comes with the Botox, that's not how she's built. So it would look good for the lady in the Botox manual, but it's not going to look good on her face. So when we take an approach to anyone's face, we always look at them specifically, and I custom apply it just for them, okay? So I do a lot of measuring and analyzing. I've done Miss Amy before, so I know right where I'm going, but I would do a lot of measuring, and I'd actually mark it out with a cosmetic pencil if she were a new client. She has a lot of lost tissue in the cheeks, which happens so much after the age of 35, and when we put that cheek back up with filler, it just takes many, many years off the complexion, okay? Doing okay? Okay, so the left side of her face is finished. Can you appreciate how we've lifted this? You see? Okay, and I'm going to finish. I won't send her home like this. We'll finish the other side of her face. The product I'm using as a filler, Botox was to calm down the wrinkling. Now what I'm doing at this particular junction of time is we're putting volume back in the face. That's not Botox. Botox calms down wrinkling, muscles that are hyperactive. Now what we're doing is filling. We're putting air back in the tire, okay? And this particular filler is Radiesse. It's made with a soft calcium. This product has been used in vocal cords and in knee repair for probably over 30 years. I've personally been using this product since about 2002, 2003. I love Restylane, Juvederm, and the hyaluronics. You may have heard some of those products before, for the lips and for under the eyes. But for the cheeks and other cheeks, temples, lower face, anywhere but the lips and under the eyes and the hollow of the eyes, I use the Radiesse because it's a thicker product. It gives you a much better fill and it lasts longer. And so about approximately 5 to 10 minutes before we started the presentation, we had put numbing cream. So I custom compound a numbing cream, very, very strong, to make it comfortable. Okay, watch my finger. Okay, Amy's finished. There's before. Any questions? Yes, ma'am. Well, Amy comes on her birthday usually every year. That's her treat from her hubby. But I have some ladies that come 3 times a year. I have some ladies that come on an anniversary or their birthday every year. And then I have some diehards who get addicted that come once every couple of months. So, as far as the fillers, fillers will last 6 months to a year depending on what type of filler that we use. And then again, well, when will I have to do the skin? It depends on the look you're looking for. If you really want a lot of volume, you can continually add on. So if you get, for example, if you purchase 2 fillers today, you may want to add another one in 2 months or 3 months down the line. Or it just depends, because some people would like very, very high cheeks. Some people, you know, want, oh, I just want a little something. I don't want it to look overly dramatic. But what we always go for in my clinic is natural. Because when you make patients look natural and not overdone, that's when they enjoy it the most. People aren't going, what did you have done? They say, oh, you look like you went on vacation. You look great. Nobody understands what has happened because it's a very soft and subtle transformation. Well, it's been my absolute pleasure speaking with you today. And give me 10 minutes and I'll give you 10 years. See ya.